Hey guys, it's Derek Z. This video is going to be about 4 simple exercises to help get your shoulders stronger. These are all exercises that I mainly give my clients who is having shoulder issues. These issues are basically a source from the rotator cuff, and these are very simple exercises where you do laying on your side and one that requires a foam roll. So all you need is a light dumbbell and a foam roller to do this. Another dysfunction that I find in the clinic when I'm seeing clients is if they have pain exerting strength within the shoulder. So a lot of times is if they're exerting strength this way, or if they're exerting strength this way, if they're kind of reaching out to the side and that hurts the shoulder. I'm going to show you how to test that in a little bit for yourself. And then last but not least, it's pain on palpation. Means that if you poke around the shoulder, you can find where it hurts. And there are certain places that you can poke around. I can show you that in a little bit to self-test, to diagnose and see whether these exercises will be helpful for you, especially if you're having these dysfunctions. These exercises can be done while you're having pain in the shoulder with certain movements, or if you're not having pain and you just want to get the shoulder stronger. If you're not having a whole lot of pain, then you can use a heavier weight or make the exercise a little bit harder or do more reps. So the first self-test is the painful arc. Very simple test. The shoulder that is hurting, let's just say it's my right side, you're gonna bring it up, and if somewhere along this arc it is painful, then that is a positive test. Usually what I see in the clinic, people are usually painful around 90 degrees to about 120 degrees, somewhere around here. There are times where actually people feel pain way up here as well too. If that is the case, these exercises will still be helpful. That's just a little bit of rotator cuff dysfunction, which these exercises will help address. The next self-test is manual muscle testing. Usually I do this in the clinic with somebody where I press down on their arm to see whether I can provoke any pain or not, which then tells me what structures are involved in the shoulder. If you're watching this at home, you're likely to be doing this by yourself, or you can ask somebody to help you. But there's 4 motions that I typically test. So I test for flexion. I get somebody's arm up and I push down to see whether that hurts. I test abduction. Same thing. I press down to see whether it hurts. I test external rotation, and then I test internal rotation. For external rotation, I'm usually out on the side and I push in on the person. And then for internal rotation, I'm usually still on the outside and I pull out to see whether that elicits any pain. There's ways to do this while you're at home, and I can show you right now. So to test flexion, I'm gonna use my table. You can really use whatever you want that you can find. At the end of the day, you just need to be resisting into flexion. So I'm gonna use this table, I'm gonna use the under part of this table. So you just bring the arm up and then you just push up. So the further out that the object is you're pushing, the more force it is on your shoulder. So you don't really want to be here because of the distance between where you're exerting force and the shoulder is so close. You want that all the way out so it can exert maximal force on the shoulder, and then you don't need to push up as hard to be able to stress the shoulder. So I'm out just at the wrist line and I'm just pushing up. That is essentially the same as if I have somebody push my arm down. You want that arm, I mean, this is not the most ideal, but you want the arm somewhat close to about 90 degrees, and you just want to hold it up there. If you're doing this yourself, you might not be able to generate enough force, so you want to compensate that by holding it for about 5 seconds or so and see if that hurts. If that doesn't hurt, there's a negative test. Next test is abduction. Bring the arm out to the side, keep the elbow straight, lift it up as high as you can go, and then hold it there for about 5 seconds. If this hurts the shoulder, then this is positive. If not, then this is a negative test. Typically when it hurts about right here in this area. Testing external rotation is next. So to test the external rotators, you're going out this way into the side. So to test external rotation, you really want to focus on rotating the humerus out. So it's rotating that way externally, hence external rotation. You're just using the forearm as a lever to push out. So I'm pushing into this piece here for me, And as I'm exerting force as hard as I can, and I'm holding for about 5 seconds just to see whether that will elicit any pain. If that elicits pain for you, then that's a positive test. Again, if not, it would be a negative test. Internal rotation is next. To test internal rotation, it is the opposite of external. Have your arm out to the side and you're rotating it in. You're rotating your fist in towards your stomach, and you're again taking the humerus and going this way. So again, you're using the forearm as a lever. I'm using this piece here again. So I'm exerting force in towards as hard as I can, holding it for about 5 seconds or so. And if that hurts, that's a positive test. Again, if not, that would be negative. The next thing I look at after that is pain with palpation. If I'm poking around the shoulder and there are structures that I can elicit pain with, then that is something I also take into consideration. So usually what I do is I poke around the rotator cuff tendons, or I poke around the back of the shoulder blade where the rotator cuff lives. I look at the bicep, I look at the pec, just to see where they're at. And I can show you all where that is, and you can do that on yourself. So the first thing I like to look at is the muscles in the back of the shoulder blade. So here's my shoulder here. I want to look at the posterior cuff, which are the two rotator cuffs that lives on the scapula. So if you reach around, you're going to find a bone. So the bone is a line that runs this way. That is the spine of the scapula. If you can find that and you pull on it, it should be hard and it should be straight. If you find that, then go right below that. The first muscle that you poke around is the infraspinatus, which is part of the rotator cuff. If you go a little bit lower than that, you should still be on the shoulder blade. That would be the teres minor. And if those are tender that you find, then that is something to take into consideration, that these exercises may be helpful for you. The next couple things I like to look at is you come around the front or the side and you follow along the edges of the shoulder. There's a little roof here. There's a piece of bone here called the acromion, which is where the edge of the scapula meets with the clavicle. So if you follow the roof, the edge of this roof, you'll come to a point where you may feel something that's ropey. And if that ropey structure is sensitive or painful, then that's also something else to take into consideration. These ropey structures, especially the one that's out into the front, more so out to the front and the side, that angles out about this way, and you're coming in here. This is the tendon of the supraspinatus, also one of the rotator cuffs that are commonly involved. And then next one is you come up to the front, still following the edge of the acromion, you'll find another ropey structure. And if you poke around that, and that's sensitive or painful, that would be part of the long head of the bicep. So you can kind of use this as a general guide to see what's affected, what's not. Don't use this as a test by itself. It doesn't really mean anything. It has to be combined with something else, because these tests are not super accurate. As you can see, as you're poking around, like especially if you're doing it yourself, you may not be on the exact same spot as if we're doing it in the clinic. If you however have a painful arc, pain with all the resisted tests, and then you can't really figure out what's going on, that in itself may be enough to have you do these exercises already. Last but not least, finding the pec. You find your collarbone here, and then you just go right underneath the collarbone and you dig deep. If those areas, that's typically tight and tender, that's also something else to take into consideration if that's what it feels like for you. So that's it for all the self-tests. If those are all positive for you, meaning your painful arc hurts, all the resisted tests is painful, and when you're poking around the shoulder, you found all sensitive structures, these exercises are going to be beneficial for you. If none of those were painful, these exercises are still beneficial for you. It just helps you create a better buffer to prevent dysfunction from happening. So the first 3 exercises are laying on your side. I learned this from a course. This is called the sideline trio, and these are all reps of 10 with 3 seconds going up, 2 seconds holding at the end range, and 3 seconds coming down. So I'll show you what that looks like. I have a light dumbbell here. This is 5 pounds. And I'm just gonna do this on my left side, or on my left shoulder, I mean. So the first exercise, you're laying on your side like this. Have your elbows close to the body. This is basically side-lying external rotation. It's a classic physical therapy exercise. You start with your fists kind of by your stomach, and then you bring this up. The only difference is when you're doing this extremely slow, 3 seconds going up, and then once you get up to the top, hold it for about 2 seconds, and then same thing, 3 seconds coming down. You are to do this about 10 times. So 3 seconds going up, 2 second hold up at the top, and then 3 seconds coming down. So 10 reps of that. That's the side-lying external rotation. That's the first of the 3 trios. The second exercise is side-lying shoulder flexion. So you start with your arms by your side, and you bring this up with a 3 second coming up, get it up to the end range, hold it there for about 2 seconds, and then bring it down, taking about 3 seconds to come down. So at the end of the day, again, you're doing this basically as slow as possible. 2 second hold up top, and then 3 second coming down. Ratio is always going to be 3-2-3 with all 3 of these exercises. The last one of the trio is called horizontal abduction while you're laying on your side. So you bring the weight out forward, and then you go ahead and bring it up, 3 second coming up, and then out to the side where you're essentially straight up, 2 second hold there, 3 second coming down, and then you repeat, 3 second going up, 2 second hold up at the top, 3 second coming down, and then you do all of these for a total of 10 times. So to review and recap, first one is side-lying external rotation, coming up, 3 second, 2 second, and then 3 seconds. 10 of those. The second one is side-lying flexion, bring it up, 3 second going up, 2 second hold, 3 second coming down. Again, 10 of those. Horizontal abduction is the last one, out to the front, 3 second going up, 2 second hold up top, 3 second coming down. Same thing, also 10 of those. That's the side-lying trio. And then we'll move on to the fourth one. So the fourth exercise is called the serratus wall slide. This is a nice exercise to strengthen the muscles that helps with overhead reach, or to help you stabilize with the shoulder being in the overhead position. So hence, if you're having pain up here, this is a nice exercise for you to do. So all you need is this foam roll. Get the foam roll on a wall. Get the arms parallel, like this. You want the forearms parallel with each other, and the foam roll about where the wrist is. Don't stand too far away from this. You want to stand pretty close to this. So kind of, again, your body is about parallel to the wall as well too. So you want to go ahead and protrude your shoulder blade into the foam roll. But if you do that, you're going to end up rounding your mid back. So the motion you're shooting for is this. You're basically protracting your shoulder blade into the foam roll. But because the foam roll is in the way, you'll end up rounding your mid back instead. So if you're doing this right, you should almost feel like you're pushing yourself away from the wall. So you hold that pressure forward, and then you roll the foam roll up, maintaining that forward pressure on the foam roll. And same thing as you're going down. And then you go up, and then you go down. If you're doing this correctly, you should feel this kind of underneath the shoulder blade in terms of where you feel the contraction occur. So kind of underneath in this area, shoulder blade, armpit region is where you should feel the burn. You'll also feel it in the delts as well. When you're doing these exercises, if you are in pain when you're doing these exercises, modify the range of motion when you're doing it, or lighten the weight, or change the speed at which you're doing it. That just means the tissue is just not ready for that type of exercise. If you're somebody that's not in pain when you're doing this, and you're just trying to build up the strength of your shoulder, you can go up in rate. You can decrease the speed at which you do it, which then generates more time under tension on the shoulder, or you can just knock out more reps. So those are some of the things that you can change in terms of parameters. For those of you who are in pain in the shoulder, do this to your tolerance. If you do this for a couple of weeks and this is not getting any better, you need to find a physical therapist to get this checked out, just to see whether this is actually a rotator cuff issue or is something else going on. That's all I have for you guys. Let me know what you think. Leave things in the comment section below if you have any questions, and I'll see you guys in the next video. Thanks for watching.